Okay, please, guys, let me know if you guys are able to see the screen. Okay, I'm gonna assume you guys are able to see the screen. I'm gonna check one more time just to make sure. Okay, very good. Let's start. So this is advanced level 3. And today we're going to talk about a very controversial topic. Like, I think we have a lot of controversial topic at this level. We're going to talk about the right to die, okay? So pretty much like you guys know, there are a lot of countries that do allow people to have the right, to have the option, and to have the choice to choose when they want to leave this world. In other words, pretty much they want to have the right to die, literally. Okay, so have you ever, guys, hear the word right to die? Guys, remember, this is a speaking class. We do more speaking than I do. I mean, you guys do more the speaking than I do. Okay, so have you ever heard about the right to die?
Yes.
Okay,
Yes.
what can you tell us about it?
In English, how to say eutanasia?
Euthanasia. Chicos, una vez más, este es nivel 3, ya tienen que tener las bases para poder hablar. Yo nada más es más como hablar y un poco de vocabulario, ¿ok? Euthanasia, ¿ok?
Euthanasia.
Okay, tell us. Dinos, does anyone have a comment about it? Guys, so I'm
I
gonna,
think
okay, go
I
ahead.
think in our country it would be very important to apply the right to die, because I think is your body, is your health, is your decision, and if you don't want to live very sick, it would be very important that you have the decision and to have the right to die.
Okay, exactly. So pretty much that's the meaning of the right to die, to make the choice, to make a decision when to end your life, okay? To pretty much use that right in order to decide if you are terminally ill, that means that you don't want to live, or if you live in a lot of pain, you have the right to choose when to end your life, okay? So guys, in general, how do you guys feel about this topic, about having the right to die? I was listening to a podcast that I probably will play to you guys, but it's very long. So I don't know if I'm gonna play it in parts. I'm gonna play in the whole thing. It depends how the class is developing. But I was listening to this podcast, and in Belgium, kids like as young as 12, no, I'm sorry, as young as 10, they can decide if they want to end their life, and if they are terminally ill, they can decide at a very young age when to end their lives. What do you guys think about this topic,
For me,
guys?
it's a important topic, and you have to talk about it with your family, with your parents or your son, because for me, I hear I wanna I wanna uh, talk about this topic with my wife. I told her this in case I have an accident or something like that. I told her that if I get in coma, I don't know how to say that.
Coma.
Okay, or I have to in I don't know how many artificial breathing. I don't know how if I say that correctly. Um, I told her I I told her there are the she had to wait 1 month, and if I can go back to life, and I told her that I disconnect me from another thing, the machine, another I don't know, because it's really expensive to keep alive in quotation a person in this case with machine connected to machine, or I don't know.
Okay. What about the rest of you guys? What do you think about? How do you feel about this subject? Having the right to die, to decide when to end your life.
Okay, in Colombia, we don't have a law uh, about the right to death with dignity,
Mm-hmm.
but the Constitutional Court has an important sentence.
Mm-hmm.
In this important sentence, this right is for three specific situations. With when you have a terminal illness,
Illness.
when it's impossible to support the pain,
Mm-hmm.
and I don't remember the other case in this moment, but
Okay.
it's in a specific case, and we have a procedure. Is necessary a special committee, a committee when with one lawyer, one doctor, and other professional.
Okay.
And yes, this is a human right for me.
Okay.
It's very important because it's not necessary to pay a lot to that. If it's impossible, the recuperation to take over, to come your situation to your normal life,
Mm-hmm.
is better to die with simple. I am
Okay.
agree to with I don't know really in English, suicide
Assisted
assistant
suicide.
to
Okay.
suicide.
So this is
Okay,
this is a
yes,
word that
I am
we're gonna
agree
see.
with Liz. Okay.
Okay. So this is a word that we're gonna see a lot today. It is assisted suicide. Can you read the meaning? Who wants to read the meaning?
The suicide of a patient suffering from an incurable disease affected by the taking of the lethal drugs provided by a doctor for this purpose.
So once again, pretty much assisted suicide, it's that if you have a patient, if you are a doctor and you have a patient that you see it's suffering a lot because he has an incurable he's terminally ill, then what are you gonna do? So a lot of people say that a lot of doctors commit crime because they help their patient there, assist their patient to end their life. But at the end of the day, I think everyone has the right to decide if they want to keep on living or they want to die. Because what about if you have brain cancer? Let's put it this way, okay? If I have brain cancer and I keep living in pain every day constantly, and I have to be like throwing up, or my I don't know, everything hurts, then I'm gonna decide to end my life because that it's not a quality of life. That actually hurt my quality of life, right? I don't have a quality of life. Why? Because I'm sick, you know? So I'm asking you guys, should euthanasia be legal? Should euthanasia be legal? What do you guys think?
Okay. In Colombia, the euthanasia is legal in three special cases. I talked about this before.
Uh-huh.
And it's very necessary to regulate the euthanasia. In Colombia, it's impossible with the Congress to regulate about the euthanasia. Why? Because we are a Catholic country, and it's necessary to take a regulation about that. Why? Because the doctor need to take a special regulation to take that decision without problems. And in Colombia, we have problems with the euthanasia in some hospitals. Why?
Okay.
Because many hospitals are Catholic. Yes, many communities, Catholic communities, has hospital, and it's impossible in that hospital to take an euthanasia. We have that problem in Colombia.
Okay, so you guys have that problem in Colombia because there is not a law that allow their citizens to actually decide over their lives if they want to continue on living or they want to pretty much say, you know what, I'm done with my life, I'm tired of doing this. I mean, I cannot have a quality of life and I'm done, no?
Yes.
So yeah, that's what happened in a lot of places. What was that? I'm sorry.
Yes, it's very difficult to find a doctor to practice the euthanasia. It's not easy, really. My sister, she is the director from the foundation to the euthanasia in Colombia, Fundación Derecho a Morir Dignamente. She has a special role in our society with this topic. But it's very difficult because not many doctors practice the euthanasia.
Okay, yeah, that's difficult because at the end of the day, because of our own beliefs, we are not able to choose to pick if we want to die or we don't want to die. Unfortunately, especially in Latin America, people have very specific ways to live. They are very traditional, and because of that because of that mindset that they have, it's very difficult for them to be like, you know what, to be open to the idea of people getting assisted suicide, you know, and because of their religion, because of tradition, because they think God is gonna punish them because they decide to kill themselves, right? Pretty much assisted suicide. So there's a lot of bad ideas about the right to die, okay, compared to other countries. So who else has an opinion? Should euthanasia be legal? What do you guys think, the other guys?
I think, yeah, it should be legal.
It should be legal for you? Why?
Because in my country, Chile, this is no laws about that. It's talking about your parent, your wife, or your husband with the doctor who take the body or take the patient. But it's not legal.
Okay.
We need some laws about that.
Okay, yeah, we need to have laws about that. That's exactly right. Yeah. So once again, it depends on the country. Usually in the European Union or the United States, they are allowed to do this without having to go through a lot of process. And even though in the well-developed countries, sometimes it's difficult, right, guys? It's very difficult to have that right. Okay, let's continue. So can you guys see my screen?
Yeah.
Okay,
Yeah.
very good. We're gonna go over about some vocabulary for you to start building up your vocabulary a little bit more. Once again, when you have advanced topics, or when you just have regular life topics, you are going to be able to talk about them because you're gonna have the enough vocabulary to talk about that specific subject. So once again, what is euthanasia? Who wants to read that definition?
Me.
Okay, go ahead.
Euthanasia. Help with a good death. Legally vague but useful as a broad descriptive term.
Okay, very good. So help with a good death. Legally vague but useful as a broad descriptive term. Pretty much end your life, right? Kill yourself, basically. That's what it means. So what about passive euthanasia? Who wants to read that definition?
I go.
Actually, oh,
Okay, go ahead.
go ahead.
Passive euthanasia, the deliberate disconnection of life support equipment or cessation of any life substance in medical procedure, permitting the natural death of the patient.
Okay, once again, passive euthanasia, the deliberate disconnection. So in this case, the difference between euthanasia and passive euthanasia is a passive euthanasia is when you are connected to a machine, okay? That's a passive euthanasia. When you decide to have a lethal injection, that will be euthanasia, just by itself, okay? Guys, do we understand the different meanings between euthanasia and passive euthanasia? Okay, so what happens with active euthanasia? Who wants to read that one?
Active euthanasia is deliberate action to end the life of dying, one moment, patient to avoid further suffering.
Okay, so pretty much active euthanasia and euthanasia, it's the same thing, okay, guys? It's the same thing. It's deliberate action to end someone's life or a patient or a dying patient. That dying patient decided to end their lives, okay? To avoid further suffering.
I think the active euthanasia is when you as a patient you ask for the end life, but in the other case can you show the first two concepts of
You can
this?
say it like euthanasia and active euthanasia. What's the difference?
The active euthanasia is when you are asking, or when you are the patient or you have illness, for example, cancer, I don't know, you ask for the death. But in the passive euthanasia, I think, for example, if you are in coma, you can talk with the doctor.
Okay. Okay,
That's
yeah.
there's a brief difference.
Okay, yeah, that's a big difference. So the next one. So we have active voluntary euthanasia. Pretty much, this one is just when you ask for a lethal injection. That's all. By a doctor into a dying patient or to end a life by a request of sufferer. Okay? So now what happens when we have an active involuntary euthanasia? Then that will be a crime, right, guys?
Yes,
Because if you give someone a lethal injection and they didn't ask for it, then you are in trouble, okay? So who can read that one?
active involuntary euthanasia is lethal injection by a doctor into a dying patient without that person's express request.
Okay, yeah, pretty much. You just give the lethal injection and that's it. So do you guys think this kind of situation happen a lot, the active involuntary euthanasia? Do you think it happens a lot?
Not really, because for the doctor is very is a risk, it's a crime. You say it's a crime, it's an injury.
Yeah, exactly. If
Not
you're
easy
doing
for the
that,
doctor.
okay, if you're asking that without the patient permission or the patient family's permission, then you are gonna be in trouble. But if you do it the right way, then you shouldn't be in trouble, okay? So once again, assisted suicide, we already said that pretty much is assisting someone in dying, okay? Assisted dying or assisted suicide. You can use both of them. If you guys know, it's assisted dying to avoid the word suicide or assisted suicide, okay? Si se les hace como que muy fuerte esta palabra, if you think it's a very strong word to use, then you can use this one, okay?
Okay.
Physician assisted suicide. Who wants to read that one?
I go. Physician-assisted suicide. A doctor providing the lethal drugs with which a dying person may end their life.
Very good. Okay, so this one, it's a doctor specifically to assist people in suicide, okay, or assist in dying, okay. What about physician aid in dying?
Euphemistic term for medical doctor assisting the suicide of a dying patient.
So pretty much it's almost the same thing, right?
Yeah, it's like all the same in
Yeah,
finish.
the same. It's just that we are going through vocabulary, but at the same time, synonyms, okay, guys? So you will have a way to express more. Even if you're expressing the same thing, you can combine them, right? So you will not be speaking in a redundant way, okay? Repetitive, okay? Self-deliverance. Who wants to read that one?
A person irreversibly ill who makes a rational decision to end his or her own life. This term is preferred by those who consider it mistaken to equate this type of action with suicide.
Okay, very good. So that's what it means, okay? Let's see two more and then we're gonna move on. So what about mercy killing? Mercy killing, who wants to do that?
I go.
Okay, go ahead.
Mercy killing, term loosely used to describe all acts of euthanasia, best defined as ending another person's life without explicit request in the belief that it is the only compassionate thing to do.
Okay, very good. So only when pretty much mercy killing is what maybe doctors or the government, it's like, you know what, this dying patient really wants to end their life because they're suffering a lot. He or she is in a lot of pain. So we're going to go ahead and do the mercy killing. Okay. Pretty much euthanasia, in other words. Okay. So last but not least, what is the cardiopulmonary resuscitation? Who wants to read that one?
Cardiopulmonary resuscitation, non-surgical massage of a heart which has stopped to try to get the organ working again. Procedure will almost always be started unless there is a DNR order.
Pretty much a do not resuscitate order, okay? So pretty much this is just a massage in the heart that has to stop working and just to bring that person into life once again. Okay, guys, does anyone have a question regarding this vocabulary? That is just for your information, and when you want to, or when you are in a setting that you're gonna talk about someone, that you're gonna talk about this, that you're gonna talk to someone about this topic, then you have more vocabulary, okay? So once again, should people be given the choice to live or die? Who wants to talk about that? Who wants to comment on that?
Yes, for me, the people be given the choice to live or die. You have this right.
Mm-hmm.
The religious concepts are different. If you think you have to live for necessary and you are not agree with the suicide, the euthanasia, it's your decision. But everybody has to give the decision to die in when he considered is necessary for him.
Okay.
Or for that person.
Okay, who else, guys? Should people be given the choice to live or die, guys? What do you guys think?
I agree. I agree with that because it's ironic. As a human right, I need to decide when I how to die, how to live, and how to die. And after that, in my case, I have decided to be cremated when I was dead, or I don't know.
Okay, when you are done, then you want to be
Incinerate,
okay.
cremated.
Okay.
I don't wanna be buried.
Okay, very good. Who else has an opinion about? Oh. Okay, who else wants to comment on that before we go into, or should people be given the choice to live or die, guys? So, does a person lose their dignity if they choose to die? What do you guys think? Do you guys, a person, lose their dignity? If I say I want to die because I'm terminally ill and I'm not feeling well, I'm in a lot of pain every day, do you guys think as a person, as a human being, do I lose my dignity? What do you guys think?
Yes, for me, the dignity is a human right. Okay. And when you can't attend for myself or you can for yourself, you have to right to decide about your life. Okay, it's your decision. If you are a reasonable person, are you adult? You can take your own decisions.
Exactly. If as long as you are adult, as long as you are okay cognitively to make decisions, you are fine to make decisions, then you can go ahead, and you should be, everyone should have the right to decide whether to end their life or not. Yes. But there should be a specific reason, right? You cannot just say, I'm depressed, I want to die. But there have been cases where people are very depressed. They have a depression as an illness. They are sick because they're depressed and they decide to end their life. What about if it's not a physical thing, but a mental illness? Do you guys, those people should have the same right?
Yes, that is most difficult than the physical illness, because the mental illness are very difficult. The people has a lot of pull of one moment of sufrimiento.
They suffer a lot.
Yeah, okay. Suffer a lot.
They go through a lot. Okay. Yeah, that's totally fine. Does anyone have another comment? Okay, guys, I have two options. Do you guys want to listen to a podcast, or do you guys want to read an article about the right to die?
Mm-hmm. Read an article.
Okay. Yeah, we can read it.
Read? Okay.
Sorry, teacher, I was late.
Oh, don't worry.
Yeah.
I was just asking myself, where is Valeria? You are always on time, but yeah, don't worry.
Yeah, sorry, I don't have my internet connection.
Don't worry. Let me just go ahead and pull the article. Where is it? Okay, very good. So please let me know when you can see the screen.
I can see the screen.
Okay, guys. Okay. Let me just see if I can do it bigger. Okay, there you go. Okay, so who wants to start reading?
Me. Okay, the right to die. The right to die. The John Roberts Court will hear its first high-profile arguments today when the justice take up a case involving doctor-assisted suicide. Oregon law allows terminally ill people to take lethal drugs to end their lives, but the Bush administration has tried to override this law by threatening to prosecute doctors involved in such cases. The Supreme Court should make it clear that Oregon can allow doctor-assisted suicide.
Okay, back then when this article was public, in Oregon, people weren't allowed to choose whether they wanted to die or not. Today, things are different. There are a couple of states that they have this law, that they have the right to die. Very soon, I'm going to play a video also. Well, there is this case about a woman named Mary, I think, in California in 2014. She had a brain cancer. It was a very aggressive cancer, and she wasn't able to choose to end her life, because back then 2014, I think 2014, there wasn't a law in California. Now, because of her death, they passed this law, and I think she decided to move. I don't know if Oregon or Minnesota, I don't remember, but either of those states, she decided to move over there and to end her life over there, because back then California didn't have that law. Okay, so let's continue. Who wants to read next? Okay, before we continue, does anyone have a question about the article, about how pretty much they're using simple past, right, guys? John Roberts course, we heard first high profile arguments, assisted, what else? There's a lot of simple past going on. Does anyone have a question about the vocabulary?
Prosecute is perseguir. Yeah.
Persecute, not so much, but investigate.
Oh, okay.
Más como investigar, okay? ¿Dónde dice override? Okay, but, okay, override es prácticamente denegar algo o no permitirlo, okay? No recibirlo. Por ejemplo, dice, but the Bush administration has tried to override this law by threatening to persecute doctors involved in such cases. En this case, override es no permitir algo que pase, ¿ok? En este caso, la administración de Bush no estaba permitiendo que pasara esta ley, porque entonces estaban amenazando a los doctores con perseguirlos, más bien investigarlos en cuestiones criminales, ¿ok? Chicos, hasta ahorita, does anyone else have a question? No? Okay, let's continue. Who wants to continue reading?
I can.
Okay.
Oregonians voted in favor of the Death with Dignity Act in 1994, and 3 years later, they voted against repeal. The Oregon law allows terminally ill people who are likely to die within 6 months to receive drugs to end their lives. When John Ashcroft, a long-time opponent of assisted suicide, became Attorney General in 2001, he issued an edict that doctors who prescribe drugs that are used to commit suicide can be prosecuted under the Federal Controlled Substances Act. The state of Oregon and a group of terminally ill patients challenged this Ashcroft directive and won.
Okay, so it says Oregonians. Pretty much it's just the name de las es un gentilicio, okay? Los Oregonians, así como los mexicanos, los bolivianos y así, okay? What is going on in this paragraph? Who can tell me in their own words what's going on in that paragraph, guys?
Bureaucracy.
Bureaucracy, okay. What else? What did you guys understand about the paragraph?
I think there was this doctor, or maybe, I don't know if it was a doctor of a lawyer, John Ashcroft, who was an opponent of euthanasia because he thinks that it's equal as suicide or kill yourself. But after some process, the state of Oregon tried to change his thinking, his things, or just a group of patients, sorry, a group of terminally patients changed the point of view and won against John Ashcroft.
Exactly. Okay. That pretty much between lawyers and the government, they were fighting if they should be allowed to pass this law about dying death with dignity act of 1994. They were fighting. Should we pass this law? We shouldn't. Why? Because of people don't think it's right. People do think they have the right to die. Because what is a terminally ill person, guys? Once again, what is a terminally ill person or patient? Who can describe that word using their own words? What is a terminally ill patient? Another word for that. I give you vocabulary, guys.
I think it's somebody who is going to die, and there's no any option to save them because all their organs are working less and less and less, and they are suffering a lot.
What about the word that I just gave you guys? Incurable disease. When someone has an incurable disease, it's the same thing as terminally ill, right, guys?
Yeah,
Yes.
just like, for example,
Yes.
terminal cancer.
Terminal, okay, yeah. A very, very hard or a difficult cancer. Yes. Who else has an opinion, guys?
An opinion?
A comment about this? No? Nobody? Okay.
For example, in Ecuador, it's not allowed. I know that in Canada, the people who try to they can assisted death. They can go to jail if it doesn't grow, if it doesn't work. And yeah, here a lot of people is a little bit religious, and they think that you should suffer until God decide. Yeah, but I know a lot of people or a lot of doctors who are trying to not be punished if they give some medicines to assist a death from patients.
Okay.
Yeah.
Very good. Okay. Who wants to read the next paragraph, guys?
I go.
Okay, go ahead.
This case normally involves two hot button issues: the right of terminally ill people to end their life, and the allocation of power between the federal government and states. But the Court of Appeals was right to resolve it more simply. Through a careful interpretation of the Controlled Substances Act, Mr. Ashcroft claimed that the law gave him the power to overrule Oregon's assisted suicide policy. But when Congress passed the act, it clearly intended to prohibit ordinary drug abuse, not to set out a federal policy on assisted suicide.
Very good. What's the meaning of hot button issues, guys? What's another word for that word? Hot button issues.
The red buttons? It's an emergency button?
Not really.
No?
Temas muy controversiales. Very controversial subjects, okay? Topics. When somebody says hot button issues, it's a very sensitive topic to talk about, okay?
Okay.
Okay. Does anyone want to make a comment about the paragraph? No? Okay, let's finish it up. Who wants to read the last one, guys?
Opponents of assisted suicide have never been able to persuade Congress to outlaw assisted suicide directly. In the absence of a congressional law, Mr. Ashcroft had no authority to interfere with the decision of Oregon's voters.
Okay, so at the end of the day, what do you guys think? I think I already told you, but do you think the law nowadays, it's a law? Do people in Oregon have the right to die, to choose to die, guys? What do you guys think happened?
Yes, the problem in the United States on medical is federal to Colombia different because we have only laws in the nation. The states has not laws. This is the big problem. But these rights is very necessary to be to states because one state is very different to other states. Some states are very conservative and other states are liberal. Is necessary to defend the autonomy of the states.
Okay, who else has an opinion about that? So just that you guys know, Oregon nowadays has a right to die law. Washington has it, which is assisted suicide. California, Oregon, Vermont, Maine, New Jersey, Hawaii, and Washington. In Montana, they still don't know, but right now those states have the law, has passed the law. Okay, so once again, about this woman that I was telling you about, back in 2014, California didn't have the law, but now they do because of her death. Okay, does anyone else have a comment, guys? No. Okay, guys, I think I'm gonna play you the podcast because I think it's going to help you also in your vocabulary. You're gonna listen to a lot of new words, and it also talks about euthanasia in the other side of the world, which will be, they focus a lot on Belgium and UK. So it'll be London and Belgium, okay? So can you please tell me if you are able to hear the podcast?
Consumer desires and costs rise abroad. There are
Can you hear, guys?
Yes.
Okay.
Yes.
signs of a fledgling revival in.
Do you have a question?
Can you start again, please?
Yeah, todavía no empieza, nomás están haciendo como comentarios principales. Okay.
British textile manufacturing. In Business at 8:30, Peter Day finds out how real it is and whether it can last. First on Radio 4, The Report. Euthanasia and assisted suicide are controversial and unsettling subjects for many people. Tonight, Linda Presley explores recent developments in the debate both in the UK and in Belgium.
Euthanasia for adults has been legal in Belgium since 2002. Now, the parliamentary upper house, the Senate, has voted by a large majority to extend the law to terminally ill children.
And once the end.
We can hear you. There's a
Teacher,
problem.
the
There's a problem.
That's fine, don't worry about it.
yeah, there's anything. Sorry.
Are there This isn't just an academic question. Over the last 2 decades, our courts have deliberated many times over questions related to the end of life. Here at the Supreme Court in London, judges have recently heard the case for reviewing the law on assisted suicide and the role of health professionals. One of the litigants is Paul Lamb, who's paralysed.
When I know I physically and mentally can't take anymore, I just want to be able to call upon the help of a doctor when I know I can't do it anymore. The pain I get at times is unbearable, and I'm constantly just thinking of ways I can end my life with dignity. I just want peace of mind. I want doctors there.
laws will inevitably become a slippery slope without the safeguards to protect vulnerable people. Appellants to the Supreme Court want more clarity on when a health professional might be prosecuted for assisting suicide. It's a step beyond the case brought by Debbie Purdy. You may remember she has MS. And in 2010, the Director of Public Prosecutions issued new guidelines after the House of Lords ruled she had a right to know whether her husband would be prosecuted if he helped her travel abroad to die. Since then, Debbie Purdy's health has deteriorated. And most recently, she's considered going to Belgium to end her life.
At the beginning of 2013, I was looking at options and different possibilities. I was suffering really badly. I had some fairly bad sores on my body and it was a problem. In Belgium, you don't wander into a doctor's surgery and say, hey, give me a lethal dose. It's a longer term discussion. It's a more open discussion that a doctor can discuss options. If you say euthanasia is an option I want to explore, a doctor can say, okay, I'm not saying no, but we could try this or we can try this, or why don't we try these drugs at the same time? And I think that freedom is really important.
Brussels' imposing Gothic cathedral dates back 10 centuries. Belgium's euthanasia law has been in place just over 10 years. It gives adults the right to choose to end their lives if they're competent and suffering unbearably physically or mentally as a result of a serious and incurable disorder.
Okay, guys, up to this point, who wants to comment on what is going on the podcast?
They just said that, for example, in Belgium is legal for adults who are suffering a lot and who had a terminal illness to be assisted by a doctor.
Okay.
But in the US it wasn't, I think.
Okay. Who else has a comment about it, guys? Okay, let's continue then.
In 2012, 1,432 deaths were recorded. And like Debbie Purdy, people don't have to be terminally ill to request euthanasia. She was first in contact with Dr. Jan Bernheim, a pioneer of palliative care and an oncologist, and an early advocate for the right to die in Belgium.
About half of the euthanasia cases in Belgium are in the home, not in the hospital. Patient family organize things. When the patient says, now I want to go, usually it's an injection or rather infusion of barbiturate, which is a strong hypnotic, and the patient dozes off within 20 seconds maybe. And then that heavy dose of barbiturate usually suffices to also halt respiration. If not, then when the patient is deeply comatose, unresponsive to any stimulus, then a muscle relaxant is injected and that stops respiration.
And how many times have you done that?
I didn't really keep a tally, maybe 25 times over the years. Yeah.
Do you remember how many times you refused somebody's request?
I never refused, I think, but I often convinced the patient that there were alternatives, and I enjoyed doing that.
Well, the Belgian Senate is housed in a magnificent 18th century home in Brussels. It's a mix of marble, parquet and leather, all lit.
So, up to this point, guys, who can comment about what just happened? What you guys just heard?
I understand he never refused to apply the euthanasia.
Okay. So there is this doctor that said that he never refused to help people in assisted suicide, but what did he say?
He always tried to convince the persons that there are other options.
Exactly.
But
yeah. Yeah, go ahead.
I think it's completely new for me because here in Ecuador we don't have something like that. And for example, my grandma suffered from a terminal cancer during 10 months, and it was horrible. But the doctors never give us this option. But at the same time, I think maybe my my aunts or my uncles and my dad also, I don't know if they are going to choose for her because she also has dementia and she can decide for herself. So for me, it's completely new. I didn't know it was allowed in Belgium.
Yeah. So once again, in a lot of well-developed countries, this is an option actually. Unfortunately, once again, because of our mindset and our traditions and the way we are raised in Latin America, we don't have that option because we are a very religious countries. Latin America are the most Catholic people, I think, in the whole world and the most religious people. And because of that beliefs, because of our beliefs, because we hold them very like strongly, we are not able to choose that, to say people think that it's morally wrong, even though it's your right, people tend to believe it's morally wrong to have the right to end your life. Okay, does anyone else have a comment, guys? Does anyone else have a comment? No? Okay, let's keep on listening to the podcast. The reason I play podcasts, guys, it's not because I don't want you to talk. No, it's because I want you to listen to the pronunciation of either a native or an Englishman, so you can keep on training your ear to listen to a different accents, okay?
By ornate chandeliers. And we've come to meet Philippe Mahou. He's the head of the Socialists here at the Senate, and he's also the architect of Belgium's euthanasia law and the one who's pushed to extend that law to children.
Philippe Mahou tells us he's been lobbied by families, and especially doctors, to legislate so children can choose to die.
Since 10 years, they ask us the possibility to extend the law for their patient.
But are those children asking to die?
Yes. Yes.
So once again, guys, this is a very controversial part of the podcast. Kids asking to die.
Pediatrics and medical doctors say that that's the reality. They ask us to try to find a solution, and the solution to extend the law. But the scandal is the disease of children. The scandal is children will die. That's the scandal. The scandal is not to try to avoid the pain for the children in this situation.
The bill would extend the right to die to children who are terminally ill and suffering unbearable physical pain if a request was agreed by parents in the medical team. Dr. Jolante van Belair, together with 16 other paediatricians, wrote an open letter to senators urging them to vote for it.
In a very seldom case, there's a child that you know for some time that we try to treat and we know is not going to be better. There's nothing we can do to make him better. And we thought that children must have the right to decide about end of life. People might think, well, if you're going to do that, you're going to play for God. But we're not deciding about life, but because this life is going to end anyway, the only thing the child wants is to determine how it's going to end. That their natural end might be very miserable or very painful or horrifying.
And has a child ever asked you to be able to die?
It's funny because they won't ask us directly. Whenever a child dies in a hospital of some disease, the other children will think about this and talk among each other. And it's often not directly a child who will talk to you, but the other children, they will say, well, we've been discussing it, and some of us think we should end another way than we've seen our friends die.
You see that we have a children's ward with prints on the wall, crocodiles. seahorses.
Dr. Marlene Renard is a hemato-oncologist at the University Hospital of Leuven. She's also responsible for the paediatric palliative care team, treating as many children as they can at home. So do her patients ask to die?
I've never had one who told me or who asked me, I can't anymore, stop it. No. The will to live is enormous.
Are there cases that you've had of children who you haven't been able to help, who have been so uncomfortable and in so much pain towards the end of life?
If we can't treat the pain symptoms with our usual medication, then we try to sedate them.
And I think you also have there's the principle of legal necessity to end life that you have as well, don't you, here in Belgium?
Sometimes if we see that it is really inhuman, the situation the patient is in, then we go to the ethical committee and we ask the permission of the ethical committee to end life, if that's really necessary. But
okay, guys, who can comment about when kids are terminally ill? What happens in those cases?
Can you say again, please?
Yeah, what happens in those cases when it comes to kids? What steps have they taken so far when they confront or when they face a situation that involves a kid that is terminally ill? Not an adult, a kid. What happens?
They are trying, but there was two opponents, and the first doctor said that he was agree. Because maybe the law should be extended also for kids, but the woman, I think she wasn't agree. But I think the topic is really hard because maybe she didn't agree. Yeah, she didn't agree. But I think the topic is really, really hard to discuss because maybe if we imagine an old man who is with who need assisted suicide, we think, oh, it's better because he had his life, he had lived his life. But with children, it is a little bit harder because you don't know how much secure they are. But at the same time, it could be controversial because they can decide also.
Okay, exactly. Who else has a comment, guys? So we have two sides of the coin, right? This side, we have the doctor that say, yeah, we should be able to assist kids with assisted suicide. But on the other hand, we also have this doctor that says, I never seen a kid that will give up. He has a willingness to live and keep on fighting, regardless of his situation. Okay, who has a comment about that, guys? I know it's a very difficult subject, but it is what it is. Okay, does anyone have a comment, guys? Just to wrap up the class, we're not going to be able to listen to the whole podcast, so maybe we're gonna pick it up next week.
Yeah,
okay,
please.
Okay, thank you.
Okay, ¿alguien más tiene un comentario último? ¿No?
Yeah, teacher, can you please send us the podcast with
we're gonna finish it on Monday.
Okay.
Porque
but maybe the keywords
el,
and because I can
el lunes se los mando, pero ya cuando lo terminemos, ¿ok? Y ¿qué más les iba a decir? Acuérdense que los temas, porque la otra vez recibí comentarios de que, ay, es el mismo tema. El tema están divididos en 2 días. Uno se abre y al otro se concluye, ¿ok, guys? Porque a veces, pues no podemos ir rápido. Tenemos que ir estando así como cómo pueden utilizar las palabras, nuevas palabras se les introduce, si tienen dudas, o sea, no me traten de correr antes de caminar, poco a poco, y van a ver que poco a poco ustedes van a ir aprendiendo las palabras, ¿ok?
Ok, thank you.
Sí.
Ok, gracias chicos, cuídense.
Bye, bye.
Hasta luego. Bye.
Bye. Thank you, teacher.
Thank you.